girl, it's noontime. What are you thinking about getting for lunch?
I don't know, maybe Chick-fil-A.
Should we wake Jaelyn up and ask her if she wants anything?
I get.
What is wrong with her?
Maybe she has some type of sleeping disorder.
Sounds like sleep apnea.
We did talk about obstructive sleep apnea.
What exactly is obstructive sleep apnea?
It's partial or complete upper way obstruction during sleeping. So obstructive sleep apnea is common in men, but it has a higher mortality rate with women, and you have a higher chance of sleep apnea when you're older than 65 years old. And it's not genetics, it's multiple factors that influence the airway patency. So according to Healthy People 2020, about 30% of Americans report less than 6 hours of sleep per night.
Good thing it's not contagious.
Yeah, it's definitely not contagious. Yeah, maybe we should mention it to her
Yeah.
to see. Maybe we should mention that she can still get checked out.
Yeah, for sure. Like to see her family doctor or something.
What are we talking about, guys?
We're discussing you and your sleeping.
What's wrong with my sleeping?
Has anybody at home ever tell you that you like sound like abnormal? Like maybe they describe it as snoring whenever you are trying to sleep?
It's like you're trying to grasp for air. Like you kind of stop breathing a little bit.
Oh my god, that is so weird because I learned about this today in class, and they said like risk factors are kind of like thick neck and small airways and just like enlarged tonsils. That is so weird.
And you know one of the main factors is cardiovascular.
Yes, and that was also part of clinical manifestations. If you have heart arrhythmias, hypertension, dry mouth, sore throat.
Do you eat a heart healthy diet? Because weight has a lot to do with it.
You're right. No, I don't eat a heart healthy diet. Maybe I should go to a doctor.
Do you have a family doctor?
No.
No? Okay. Well,
We can look some doctors up and maybe
she can go to our family doctor.
Who?
Mine and my family's Dr. Caisedo. I'll go ahead and give you her number. Maybe you can set up an appointment with her.
That'll be great.
Awesome.
Thank you.
Hi, Jaelyn. My name is Faith. I'm going to be your nurse today.
Hello.
So, what brought you into the hospital today?
Well, my friends and I were discussing my sleeping pattern and how I would take pauses in between my airflow while I was sleeping. So I just decided to come in today because I was a little concerned about that.
Okay. Yeah, the things you're describing sound like a little bit like some sort of sleep apnea, but I can't diagnose you. I'm going to wait for the doctor to do that. But in the meantime, I'll go ahead and take your vital signs. Alright, so your blood pressure is 142/89, which is pretty high. Is that usually your blood pressure?
Honestly, I can't even tell you because I really don't go to the doctor as much as I should.
Okay.
Wow, that is a really big number.
Yeah, it is. Yeah, hypertension is actually one of the risk factors for sleep apnea. I'll go get the doctor so she can talk to you more about what's going on with your sleeping patterns. All right. You have any questions right now?
No.
Okay.
Hello, Jaelyn. I'm Dr. Caicedo. How are you doing today?
I'm doing okay, thanks for asking.
What brings you in today, ma'am?
Oh, well, as I was explaining to the nurse, I came in because me and my friends were talking about my sleeping, and they noticed that I would take a lot of pauses in between while I was sleeping. So I was a little concerned about that, so I just wanted to get checked to see what it might be.
Oh, okay. And you said that they mentioned that you probably had obstructive sleep apnea?
Yes.
Okay. How familiar are you with obstructive sleep apnea?
Well, I've learned a little bit about it in school. I do know like some clinical manifestations could be like hypertension, arrhythmias, insomnia, dry mouth, sore throat, and daytime sleepiness.
Okay. A good way to prevent sleep apnea is weight management because the fat in the neck restricts ventilation Also, I'm not sure if you take any sedatives, sleeping pills. Do you drink any alcohol or smoke?
I drink alcohol.
Okay, so we want you to try to stay away from these as much as possible because what these things do is it relaxes the muscles of the upper respiratory airway, and this is what's causing those pauses in your breathing. So we want to try to stay away from those as much as possible, especially right before you're going to bed. A heart healthy diet will also help with the weight, and for now I can recommend you to sleep on your side. But these are just a few ways to prevent obstructive sleep apnea. I'm going to go ahead and refer you to a specialist, Dr. Olivares. The assistant at the front will give you more information on where you can go and how you can contact him to set up an appointment with him. But it is very important for you to get this checked out. For some reasons, obstructive sleep apnea can cause decreased concentration, headache, difficulty in your interpersonal life because you may feel groggy, you may have mood swings. Excessive daytime sleepiness can cause a motor accident that's very dangerous. And even anxiety because, nobody likes the feeling of not being able to breathe. So today I'm just going to go ahead and prescribe some lisinopril for the high blood pressure. I think your blood pressure was 142/89. That's a little high. So I'm just going to go ahead and prescribe that, and then I'm going to go ahead and refer you to Dr. Olivares so he can do a couple diagnosis tests and confirm that obstructive sleep apnea is the issue. Do you have any questions for me?
No.
Alrighty, it was nice meeting you. Have a great day.
Thank you, you too.
Thank you.
Come in.
Hello,
Hello.
my name is Dr. Olivares.
Nice to meet you.
I said Dr. Caisedo referred you to me.
Yes.
Okay. What did she say?
Well, basically, she told me in other words that I have obstructive sleep apnea or
Okay.
some sort.
Okay. So we can do a polysomnography, which is basically monitoring your brain, your heart, your lungs, so your respirations, and your blood oxygen levels. Okay.
Okay.
We're also looking at whether if you snore and moving of the extremities, which will help in diagnosing this condition. Okay.
Okay.
Would you like to do this here at the clinic?
Yes.
Okay, so that makes it much simpler. So if we're going to be doing this here, we're going to set up a machine here, and we're going to have you lay down, sleep like normal, okay?
Okay.
And we'll be doing this tonight?
Okay.
Okay. Is that okay with you? Any schedule problems?
No.
So we'll be seeing you later on tonight?
Okay.
Okay.
Thank you.
So I just wanted to review the results with you, and it does look like you do have obstructive sleep apnea. Okay? Yes. And some treatment options here that we have is using a CPAP or a BiPAP. Have you heard of that before?
I've heard about it, but I'm not too sure what it is.
Okay, so a CPAP is a continuous positive airway pressure, and it basically helps with breathing, okay?
Okay.
So there's two types. So there's a fixated and an auto-titrated, and the fixated one stays the same positive pressure at all times, and then the auto-titrated changes as you breathe. There's also a BiPAP, which changes as you inhale and exhale. So there's different pressures on both ends, okay?
Okay.
And if this doesn't work out and you eventually have severe obstructive sleep apnea or some sort, we can refer you to surgery. That can be removal of any of the nasal polyps you have, any removal of the tonsils or the adenoids. So as you know, this treatment or machine may be expensive to some patients, and there are some resources which the nurse will explain to you. We will also be doing a follow-up treatment in 2 weeks to see if we need to adjust the pressure of the machine. Okay?
Okay.
Do you have any questions?
No.
Okay. Nice to see you.
Thank you.
Hi, Jaelyn. How was your talk with the specialist?
Oh, wow. I've learned that I have obstructive sleep apnea.
Fortunately, since it's a common disorder, I have a lot of resources here for you. So as you've probably heard from your doctor, chronic sleep loss from sleep apnea has a lot of negative consequences, including impaired ability to concentrate, impaired memory, failure to accomplish daily tasks, and interpersonal difficulties. I'm pretty sure either the specialist or the doctor told you that, you know, when you stop like breathing in the night, it can probably cause some anxiety to both you and your partner who's sleeping with you. A great website that's dedicated solely to information about sleep apnea and all that is sleepapnea.org, which is backed by the American Sleep Apnea Organization. And if you need a CPAP, as a specialist said, they can be very expensive. But there's something called the CPAP Assistance Program, which has provided over 7,500 CPAP equipment packages to those who need it. And if you're looking for support groups, there are a lot, including the ASAA Apnea Support Forum, which is an online support group. So if you don't want to like go out and drive, you can just stay on your computer. And there's also an organization called Awake that has support groups in Texas, in Houston actually, and they meet monthly. And again, there are also a bunch of sleep specialists here in Houston, one of which you talked to already. And before you go, sometimes a CPAP may not be enough to help manage your sleep apnea. So there's something called pulmonary rehabilitation, which if you use it with your CPAP therapy, it can help improve your breathing in the night and just in general. So it's an outpatient program. It may be based in either a hospital or a clinic, and you can even be able to receive some forms of pulmonary rehabilitation in your house if you want to. Alright, so here's a brochure that has all of that information on there for you. Do you have any questions?
No, thank you.
Alright, nice to meet you. Thank you so much.
Thank you. So guys, I just came from a specialist, and it turns out I do have obstructive sleep apnea. A lot of things that you guys were telling me, that's what they were recommending, like weight loss, a healthy diet, increasing my physical activity. So I know it's going to be really hard for me to do, so I'm just going to try to take baby steps, try to increase my dietary intake of greens.
We all might have sleep apnea. Insomnia is a problem.
We surely do.
I don't get sleep.
Sleep deprived, in school.
Working, struggling.
Okay.
Well, don't diagnose me just yet, because I don't be snoring like a horse.
But that's good though. I'm glad that you were able to catch it
And definitely treat it, because remember those complications that we learned about in class? Those are pretty serious. Like, you could get into a motor vehicle accident, decrease concentration, and you need all the concentration you can get for nursing school.
And Lord knows I don't need any added anxiety. Ooh, child.
All right, but well, I'm glad you got that checked out.
Now let's get back to studying.
Back to the topic of obstructive. Yeah.
My name is Dr. Olivares. How are you?
Finding yourself.
What's your name?
Jaelyn.
Okay. Let's start.
Come in.
Hello.
Hello.
My name is Dr. Olivares.
Nice to meet you.
Good. How about you? And if this case, if it's not so severe, we can also just use jaw. I can't. You guys are making me nervous. Okay.
Why nervous? I'm just gonna go ahead and prescribe some lisinopril for.
So,
How do you say it?
I mean,
Yeah.
Sisters through tea. And I studied. What? Through tea. And I bought some camouflage plans and some little shorts.
You bought some
Some camouflage. Girl, you know how we
You
talk.
said you bought some camouflage plants.
Camouflage. Wait.
Do you have any questions?
No, thank you.
Alright, nice to meet you. Thank you so much.
Thank you.
And that's how it's done.